Diagnosis and treatment of internal diseases. 3. Cough. Cough that is often accompanied by cold, bronchitis, pneumonia, bronchiectasis, and tuberculosis usually results from the invasion of exogenous pathogens that cause pulmonary dysfunctions. It can be divided into two types of invasions, those of exogenous pathogenic factors and those of endogenous factors. They are subdivided into four types. 1. Cough caused by the invasion of exogenous pathogenic factors. Wind-cold type. It is a cough with diluted white sputum, sore throat, chills, and a thin and white tongue coating. The pulse is superficial. Treatment. 肺腧 bladder 13, 列缺 lung 7, and 颌骨 large intestine 4. This prescription can expel bad wind and clear away cold, open the inhibited lungs' energy, and relieve the cough. Needle 肺腧 bladder 13 towards the spinal column with an even movement method for 1 minute and withdraw the needle. Then apply the cupping method on each side. Needle 列缺 lung 7 transversely. And 颌骨 large intestine 4 perpendicularly with an even movement method. Retain the needles for 15 minutes. Treat once a day. 8 treatments compose a course. Exhort the patient to avoid cold and wind, raw or cold food, and cold drinks during the treatment. Wind-heat type. It is a cough with purulent thick sputum, fever, and thirst. The tongue coating is thin and yellow. The pulse is superficial and rapid. Treatment. Puncture 大椎 do 14, 雨季 lung 10, 肺腧 bladder 13, 列缺 lung 7, and 颌骨 large intestine 4. This prescription can expel bad wind and heat, open the suppressed lungs' energy, and relieve the cough. Needle perpendicularly 大椎 do 14, and 肺腧 bladder 13 towards the spinal column with the reducing method of rotation for half a minute, and then withdraw the needles. Needle 列缺 lung 7, 颌骨 large intestine 4, and 雨季 lung 10. Ask the patient to avoid raw cold food or pungent smelling animal products such as fish. Two, cough due to endogenous factors. Stagnation of phlegm wetness in the lung. It is a cough with white mucoid sputum and a white and sticky tongue coating. The pulse is slippery. Treatment. 大椎 do 14. 貔貅 bladder 20. 列缺 lung 7. And 方龙 stomach 40. This prescription can strengthen the spleen, disperse dampness and phlegm, and relieve the cough. Needle 大椎 do 14 with the even movement method for half a minute. After withdrawing the needle, apply cupping to the point. Needle 貔貅 bladder 20 with the reinforcing method of rotation for half a minute. Needle 列缺 lung 7 with the reinforcing method of twisting. Needle 方龙 stomach 40 with the even movement method, then withdraw the needles after 15 minutes. Treat once a day or once every other day. 10 treatments constitute one course. Exhort the patient to avoid raw or cold food, shrimps and crabs, and avoid cold drinks, wine and smoking. The patient should be kept warm. Dryness of the lung due to deficiency of yin. The patient of this type of cough has no or scanty sputum and has a mild fever. The tongue is red with a thin coating, and there is a thready and rapid pulse. Treatment. 肺腧 bladder 13. 齿子 lung 5. 列缺 lung 7. This prescription can nourish yin, disperse heat, and relieve the cough. Needle obliquely at 肺腧 bladder 13 towards the spinal column with the reinforcing method of rotation for half a minute. Needle 齿泽 lung 5 and 列缺 lung 7 with the even movement method for half a minute. Retain the needles for 20 minutes. Treat once or twice a day. Exhort the patient to avoid pungent food, cigarettes, and wine. Asthma. Asthma is usually caused by wind cold or wind heat. The patient is allergic to pollen, dusty pungent smells, seafood, and other odors that can lead to pulmonary or tracheal disorders. The patient feels shortness of breath and wheezing during light exercise. There are 3 types of asthma. 1. The wind-cold asthma. The patient has shortness of breath, cough, aversion to wind, and thin sputum. The pulse is floating and tense, and there is a thin and white tongue coating. Treatment. Group 1. 定床 extra point. 天突 Ren 22. 齿泽 lung 5. Group 2. 方门 bladder 12. 天突 Ren 22. And 列缺 lung 7. Applying these 2 groups alternately can eliminate wind, expel cold, facilitate the circulation of pulmonary qi, and relieve the asthma as well. Needle Ding Chuan, extra point bladder 1, with the twisting and reducing method, and withdraw the needle 1 minute later. Needle Tiantu Ren 22, downward with the twisting and reducing method, and withdraw after 2 minutes. Treat Chizhe Lung 5 with the same method as above, and retain the needle for 20 minutes. Treat once or twice a day. Lung Asthenia type. This type reoccurs every winter. The pulse is soft and weak, and the tongue is pale and has a greasy coating. We should treat the disease early in summer instead of winter to completely cure the illness with non-scarring moxibustion using small moxa cones. Treatment: Group 1. Dazui, Do 14, and Fei Shu, Bladder 13. These points are used for the first treatment. For the second treatment, puncture Fengmen, Bladder 12, and Shenju, Do 12. For the third treatment, puncture Zusanli, Stomach 36. This treatment can invigorate the pulmonary qi. First, choose Dazui, Do 14, and Fei Shu, Bladder 13. Warm them with 3 small moxa cones and musk powder. After 10 days, apply moxibustion to Shenju, Do 12, and Fengmen, Bladder 12, with 3 moxa cones. 10 days later, apply moxibustion to Zusanli, Stomach 36, with 3 moxa cones. The course is made up of 3 treatments. Kidney Asthenia type. This type becomes more severe after physical activities, particularly in winter. The pulse is deep and thready, the tongue is dark and pale, and the lips are dark. Treatment: Group 1. Danzhong, Ren 17, and Qihai, Ren 6. Group 2. Dazui, Do 14, and Fei Shu, Bladder 13. Using these 2 groups of points alternatively can invigorate the kidneys and relieve asthma. Warm Danzhong, Ren 17, and Qihai, Ren 6 with moxa sticks for 20 minutes. The second group of points is treated with the same method mentioned above. Treat once a day or once every other day. 8 treatments constitute 1 course of treatment. The patient should keep warm and eat warm food. Avoid cold drinks, seafood, cigarettes, or wine. Common cold. The common cold is usually caused by exogenous pathogenic factors, including upper airway infection caused by bacteria or viruses. One, wind cold type. The wind cold type is always accompanied by headaches, chilliness, runny nose, and cough. The pulse is wiry and tense, and the tongue has a white and thin coating. Fengchi, gallbladder 20, Taiyang, extra point, Yinxiang, large intestine 20, Fengmen, bladder 12, Lieque, lung 7, and Hegu, large intestine 4. This prescription can disperse wind, clear away the cold, and relieve exterior syndrome. First needle Taiyang, extra point perpendicularly. Then needle Yinxiang, large intestine 20 obliquely, and needle Lieque, lung 7 transversely, with the needle tip upward. Needle Hegu, large intestine 4 perpendicularly with a twisting and reducing method for half a minute. Retain the needles for 10 minutes. Puncture Fengchi, gallbladder 20, and Fengmen, bladder 12, with the twisting and reducing method for half a minute, and withdraw. Apply the cupping method for Fengmen, bladder 12. Exhort the patient to drink more hot water and avoid cold during the treatment. 2. Wind heat type. In this type, the patient feels headache and a distending sensation in the head, has aversion to cold, has a fever, is sweating, and has a sore throat. The WBC count is normal. The pulse is floating and rapid. The tongue coating is thin and yellow. Treatment. Puncture Dazui, do 14. Fengmen, bladder 12. Quzhi, large intestine 11. Yuji, lung 10. Shaoshang, lung 11. Hegu, large intestine 4, and Taiyang, extra point. This prescription can disperse wind and heat and relieve the exterior and sore throat. First, needle Dazui, do 14, and Fengchi, gallbladder 20, towards the spinal column with a twisting and reducing method for half a minute, and withdraw the needles. Then needle Taiyang, extra point, Quzhi, large intestine 11, Hegu, large intestine 4, and Yuji, lung 10, with the twisting and reducing method for half a minute, and retain the needles for 10 minutes. Prick Shaoshang, lung 11, with the needle. Let it bleed about 3 drops of blood. Treat twice a day. Let the patient drink more hot water and avoid cold. Palpitation and anxiety. Palpitation is usually caused by the deficiency of heart qi in blood, or stagnation or phlegm in the heart meridian, which leads to timid arrhythmia, coronary heart disease, pulmonary heart disease, rheumatic heart disease, and hyperthyroid heart disease. There are 5 types of palpitation. 1. deficiency of heart qi. The patient feels palpitation, shortness of breath, stuffiness in the chest, and lassitude. The pulse is thready and slow. The tongue is swollen and pale. ECG shows sinus arrhythmia. Treatment: Xinshu, bladder 15, Niguan, pericardium 6, and Zusanli, stomach 36. This prescription can invigorate the heart qi, calm the mind, and relieve palpitation. Needle Xinshu, bladder 15, towards the spinal column with a slow and rapid reinforcing method, and withdraw the needles after 1 minute. Then apply moxibustion with moxa stick for 15 minutes. After that, let the patient adopt a supine posture. Needle Niguan, pericardium 6, and Zusanli, stomach 36, with a slow and rapid reinforcing method for half a minute, and retain the needles for 10 minutes. Treat once every other day. 10 treatments make up 1 course. 2. Heart yin deficiency type. The patient has palpitation, restlessness, insomnia, dizziness, and a dry mouth. The pulse is thready and rapid. The tongue has a thin coating. ECG shows sinus tachycardia and ventricular premature contraction. Treatment: Jueyishu, bladder 14, Niguan, pericardium 6, Saninjiao, spleen 6, and Anmian, extra point. This prescription can nourish heart yin, calm the mind, and relieve palpitation. Needle Jueyishu, bladder 14, towards the spinal column with an even movement method for half a minute, and withdraw the needle. Needle Anmian, extra point, Niguan, pericardium 6, and Saninjiao, spleen 6, with an even movement method for half a minute, and retain the needles for 20 minutes. Treat once a day or once every other day. 10 treatments make up 1 course. Three. Palpitation due to retention of phlegm in the body. The patient feels palpitation, shortness of breath, stuffiness in the chest, aversion to cold, and chest pain. The pulse is wiry and slippery. ECG shows sinus bradycardia, sinus irregularity, and premature arterial pulses. The tongue is red with a white coating. Treatment: Juque, Ren 14, Nieque, lung 7, and Fenglong, stomach 40. This prescription can eliminate the retention of phlegm, calm the mind, and relieve palpitation. Apply moxibustion at Juque, Ren 14, and Fenglong, stomach 40, with moxicones 3 times. Needle Lieque, lung 7, with the needle tip point upwards, and apply an even movement method. Retain the needle for 10 minutes. Treat once every other day. 10 treatments make up 1 course. stagnation of heart blood. The patient has had palpitation for several years, accompanied by paroxysmal chest pain, stuffiness in the chest, and shortness of breath after activity. The pulse is thready and choppy. And the body of the tongue is purple and dark with white coating. ECG shows premature arterial pulses and left ventricular hypertrophy. Treatment: Danzhong Ren 17, Juanshu Bladder 14, Jiangji Extra Point T4 and T7, and Meiguan Pericardium 6. This prescription can warm the heart blood, dispel the blood stagnation, and relieve palpitation. First needle Jiangji Extra Point 4 and 7 with the even movement method for 1 minute and withdraw the needle. Apply the cupping method and moxa stick at Juanshu Bladder 14 for 20 minutes. Then needle Danzhong Ren 17 and Meiguan Pericardium 6 with an even movement method for 1 minute and withdraw the needles. Treat once a day or once every other day. 10 treatments make up 1 course. Deficiency of heart yang. The patient feels severe palpitation accompanied by asthma, aversion to cold, swelling in both ankles, and reduced urination. The pulse is slow and deep. The tongue is pale and swollen with tooth marks. ECG shows arterial fibrillation and premature arterial pulses. Treatment: Danzhong Ren 17, Juque Ren 14, Qihai Ren 6, Meiguan Pericardium 6, and Zusanli Stomach 36. This prescription can invigorate qi and warm the yang, strengthen the heart, and relieve palpitation. Apply moxibustion with moxa stick on Danzhong Ren 17 and Qihai Ren 6 for 10 minutes, and then needle Meiguan Pericardium 6 and Zusanli Stomach 36 with a twisting and enforcing method, and retain the needles for 10 minutes. Finally, apply moxibustion at Juque Ren 14 for 10 minutes. Treat once a day or once every other day. 10 treatments make up 1 course. Keep the patient from becoming fatigued or catching cold. He should avoid smoking, alcohol, and greasy foods, and his sleeping patterns and emotions should be kept normal and stable. Insomnia. Insomnia is usually caused by anxiety, terror, depression, and improper diet, which leads to irritability, neurasthenia, and so on. There are 4 types of insomnia. 1. Imbalance between heart yang and kidney yin. The patient has insomnia caused by anxiety. The pulse is thready and rapid, and the body of the tongue is red. Shenmen, Heart 7, Saninjiao, Spleen 6, and Anmian, Extra Point. This prescription helps conserve the heart fire and keep the kidney yin in balance and calm the mind. Needle Anmian, Extra Point with the even movement method and retain the needle. Needle Shenmen, Heart 7, and Saninjiao, Spleen 6, still with the even movement method, and retain the needles for 30 minutes. Treat once a day. 10 treatments make up one course. Flaming up of the liver fire. The patient has insomnia caused by depression, which leads to the flaming of the liver yang. The pulse is wiry, and the body of the tongue is covered with a thin and yellow coating. Treatment: Taizhong, Liver 3, Shenmen, Heart 7, and Anmian, Extra Point. This prescription can suppress the liver yang and relieve mental stress. Puncture Taizhong, Liver 3, with the twisting and reducing method. Needle Anmian, Extra Point, and Shenmen, Heart 7, with an even movement method, and retain for 30 minutes. Treat once a day. 10 treatments consist a course. Heart and spleen deficiencies. The patient has insomnia caused by worry, which leads to deficiency of the heart and spleen. The pulse is thready and weak, and the body of the tongue has a white coating. Treatment: Pishu, Bladder 20, Shenmen, Heart 7, Saninjiao, Spleen 6, and Anmian, Extra Point. This prescription can strengthen the heart and spleen, nourish the heart, and calm the mind. Treat Pishu, Bladder 20, with the twisting and reinforcing method, and withdraw the needle after a half minute. Puncture Anmian, Extra Point, Shenmen, Heart 7, and Saninjiao, Spleen 6, with an even movement method, and retain the needles for 30 minutes. Treat once a day. 10 treatments make up one course. Four, disharmony between the spleen and the stomach. The patient has insomnia caused by a poor diet, which leads to a stomach qi disorder. The patient has a slippery pulse together with a greasy tongue coating. Treatment: Weishu, Bladder 21, Zusanli, Stomach 36, Shenmen, Heart 7, and Anmian, Extra Point. This prescription can regulate the stomach qi and relieve mental stress. Needle Weishu, Bladder 21, with the even movement method, and withdraw the needle after half a minute. Needle Anmian, Extra Point, Shenmen, Heart 7, and Zusanli, Stomach 36, with the even movement method, and retain the needles for 30 minutes. once a day. 10 treatments make up one course. Hysteria. Hysteria is caused by severe depression and stress, which leads to irritability and restlessness. There are two types of hysteria. 1. Deficiency of the heart and the spleen. The patient has abnormal facial expressions, accompanied with indifferences, palpitation, insomnia, lassitude, and poor appetite. The pulse is slow and thready, and the tongue is pale and has a thin coating. Treatment. Xinshu, bladder 15, Pishu, bladder 20, Renzhong, do 26, Shenmen, heart 7, Neiguan, pericardium 6, Zhusanli, stomach 36, Fanglong, stomach 40, and Saninjiao, spleen 6. This prescription can strengthen the spleen, invigorate the vital energy, nourish the heart, and calm the mind. First needle Xinshu, bladder 15, towards the spinal column with an even movement method for half a minute, and then withdraw the needle. Needle both sides of Pishu, bladder 20, with the same method mentioned above. Needle Shui Go, do 26, twisting for half a minute. Then needle Neiguan, pericardium 6, and Shenmen, heart 7, Zhusanli, stomach 36, Fanglong, stomach 40, and Saninjiao, spleen 6, with the even movement method, and retain the needles for 30 minutes. Treat once a day. 8 treatments constitute one course. Deficiency of the heart and the kidney. The patient feels mental confusion accompanied with reticence, less frequent speaking, dizziness, tinnitus, palpitations, insomnia, and soreness of the lower back. Sometimes the patient may have tremors of the 4 extremities. The pulse is thready and rapid, and the tongue is red with a thin coating. Treatment. Shenshu, bladder 23, Yanglingquan, gallbladder 34, Yongquan, kidney 1, Taizhong, liver 3, Xinshu, bladder 15, Shenmen, heart 7, Saninjiao, spleen 6, and Neiguan, pericardium 6. This prescription can nourish kidney yin and relieve mental stress. Needle Xinshu, bladder 15, obliquely with the even movement method for half a minute, and then withdraw the needle. Then needle Shenshu, bladder 23, perpendicularly with the same method mentioned above. Needle Neiguan, pericardium 6, and Shenmen, heart 7, with the even movement method for half a minute, and retain the needles. Needle Yanglingquan, gallbladder 34, Saninjiao, spleen 6, Taizhong, liver 3, and Yongquan, kidney 1, with the twisting reinforcing method, and retain for 30 minutes. Treat once a day or every other day. 8 treatments constitute one course. For dysphagia, needle Tiantu, Ren 22, with the even movement method for half a minute. For erythemas, we needle Xiaguan, stomach 7, Jiache, stomach 6, and Hegu, liver 4. Twist the needles slightly for half a minute and withdraw. Flaccidity syndromes. Wei or flaccidity syndromes are characterized by muscular flaccidity or atrophy of the extremities with motor impairment caused by acute myelitis, polyneuritis, sequela of poliomyelitis, myodystrophia, peripheral paralysis and hysterical palsy, consumption of saliva due to lung heat, retention of damp heat, deficiency of qi in blood of the liver and kidney, or trauma of the lower extremities. Generally, there are 3 types. 1. Lung fluid attack heat evil. Wei syndrome occurs in the right extremities, which is accompanied by cough, irritability, and fever. The temperature and size of the lower extremities are different. The pulse is thready and rapid, and the body of the tongue is red with a yellow coating. Treatment: 指责 lung 5, 裂缺 lung 7, 雨季 lung 10, 闭关 stomach 31, 腹吐 stomach 32, 两周 stomach 34, 足上里 stomach 36, 解析 stomach 41, 环调 gallbladder 30, and 旋中 gallbladder 39. This prescription can disperse heat from the lung, regulate body fluid, and cure the flaccidity. Needle 尺子 lung 5, 裂缺 lung 7, and 雨季 lung 10 on the affected extremities with the reducing method of rotation for half a minute and retain for 10 minutes. Needle 缓跳 gallbladder 30, 闭关 stomach 31, 腹吐 stomach 32, 两秋 stomach 34, 足上里 stomach 36, 旋中 gallbladder 39, and 解析 stomach 41 with the even movement method for half a minute, then retain the needles. Stimulate 缓跳 gallbladder 30 and 闭关 stomach 31 with the electrical acupuncture apparatus with sparse wave for 20 minutes, once a day or every other day. 15 treatments constitute one course. Damp heat type, or the Wei syndrome in the right lower extremities. Symptoms accompanied are heaviness, abdominal distension, soreness and painfulness of the lumbar region, a bitter taste in the mouth with sticky, burning and red urination, a soft and rapid pulse, and a yellow and greasy tongue coating. Treatment: 闭关 stomach 31, 足上里 stomach 36, 缓跳 gallbladder 30, and 旋中 gallbladder 39. This prescription can eliminate dampness, disperse heat, and cure flaccidity. Needle perpendicularly at 缓跳 gallbladder 30, 闭关 stomach 31, 足上里 stomach 30, and 旋中 gallbladder 39 with the reducing method of lifting and thrusting for 1 minute. Then treat them by using sparse waves of electrical acupuncture for 20 minutes. Treat once a day or once every other day. 5 treatments constitute one course. Traumatic Wei syndrome. Traumatic Wei syndrome in the left lower extremity exhibits the symptoms of decreased leg size and weakness of the body. The pulse is thready and stringy, and the tongue is covered with a thin white coating. Treatment: 阴明泉 spleen 9, 腹吐 stomach 32, Liangqiao, stomach 34, Zusongli, stomach 36, and Jis, stomach 41. This prescription can remove blood stasis, nourish muscle, and cure flexidity. Needle Fuzhu, stomach 32, Liangqiao, stomach 34, Zusanli, stomach 36, Jiexi, stomach 41, and Yinlingquan, spleen 9, on the left side with the reducing method of rotating, lifting, and thrusting for half a minute. Then withdraw the needles. Tap on the Yangning and Taiyang meridians from the upper to the lower part with the 7-star needle 12 times. Then apply moxibustion at Nei Xiyan, extra point, in Zusongli, stomach 36, with moxa stick for 20 minutes once a day.